Good evening, Professor Carmoyle and class. My name is Susan Belak, and today I will be discussing the topic of euthanasia, the right to die. This is the topic of my third paper, a persuasive essay. Euthanasia is known as assisted suicide or mercy killing, the means of taking one's life to relieve intractable suffering from a terminal disease. Everyone should have the choice to make their decision and have the right to die. Having to face an inevitable life-threatening disease of illness, patients should have the ability to make a choice to end their life with respect and dignity, and not to suffer. This has been an ongoing debate in the United States since the early 1800s. Most believe the normal process of dying is the natural process. There are different types of euthanasia. Voluntary, which is conducted with consent from the patient, meaning the patient does allow someone to inject a lethal injection of medication in them to end their lives, or involuntary, where the patient is incapacitated and someone must make the decision for them. There has been several attempts made to legalize euthanasia in the United States, and presently there's only 3 states that allow this: Oregon State, Washington State, and Montana. They have a physician-administered euthanasia, and it is legal in those states. Religious and cultural opinion feel that the natural way is the best way to die, and that they feel that euthanasia is not a supported form of dying. That the hospice, the American Medical Association, Democrats and liberals all feel the same way, that there should be no attempts to allow euthanasia to be made legalized in the United States. Most of these groups believe that euthanasia requests are due to patients feeling depressed and fears of being ill, and these groups also believe that euthanasia is a form of murder. That it's an assistance to end the life of a terminal patient. They believe the Bible is the way that most individuals should die. The other belief is that euthanasia is made legal instead of seeking treatment. If someone has a terminal disease and they want to die, they can refuse treatment either way. They can take it or leave it. Terminal patients really have the choice to not seek out medical treatment, so they can do their own type of euthanasia, which is just the natural way of dying but refusing treatment. Euthanasia is more advantageous, I feel. Families and individuals suffering with this terminal disease or illness, they don't have to watch their loved ones go through an agonizing death and the heartache that their family members suffer as well. The individual dying from the illness can die a dignified death and does not have to go through pain and suffering. Living in the United States, we have many rights. We have the right of freedom, the right of freedom of speech, and to pay taxes, and the right to die. So why should the government allow us we can make our own decisions to give birth or not give birth via abortion? Why can't we make our own decisions as well on, ending our lives if it's for a legitimate reason? When diagnosed with a terminal disease or illness, an individual life is not the same. Their life is pretty much coming to an end anyways, and they are very, very sick. Not being able to engage fully in life without suffering makes euthanasia a better option for individuals. Why would anyone want to live or be forced to live in pain and not be able to eat, have to take treatments they don't need? Family and friends suffer watching a loved one die, not being able to do anything to help them, not being able to feed them, take care of them. Euthanasia is the most moral treatment to provide relief for anyone suffering from an incurable, terminal, and painful disease. There's 2 cases that I've read about and I know about, which is Karen Quinlan and Terry Scavo. These women had non-reversible comas where they were in a vegetative state, and it took many years where they're on respirators and feeding tubes, and once taken off the artificial means of life, the respirator and the feeding tubes, they passed peacefully away, which they wanted the families wanted them to pass away that way anyways. The best way to understand why euthanasia should be made legal in the United States is if you have a family member who've gone through this, a friend who's gone through this type of illness or terminal disease, and you know of someone who has experienced it. It's a very heart-wrenching thing to see someone suffer a terminal disease, a life-threatening disease, and you just watch them wither disgracefully to death. Not having any ability to help the individual who's dying also relieve themselves, euthanasia would be the way to go. You would alleviate discomfort, suffering, rotting, not even be able to take medications that you can do to make your life better. Euthanasia should be made legal, I feel, is because I've experienced it, and it is a horrific thing to experience with a loved one. Utilizing the healthcare facility, hospice, it's great to have them there to alleviate some of the, suffering and discomfort, but inevitably, euthanasia would be the way to allow our individuals in the United States to die a dignified and peaceful death. Thank you.